welcome to my virtual couch. Happy Friday to ya. So, in my last episode, it was a really fun episode. I got to do a video with my sister and best friend, and we talked all things motherhood. So if you have not checked out the video, please check it out. It might be one of my favorite videos thus far. Anyway, so this is a time that I am talking to my clients about the weather's changing, fall is here, winter is coming, and this is a time where we see increased cases of seasonal affective disorder, also known as seasonal depression. And I start having conversations with my clients around mid-August because I think it's important to prepare. I live in a state with seasons, right? And so I noticed that around the fall, I have clients that depression may be going up, anxiety may be going up, and that tells me, okay, it's time to talk about how to prepare, because if you live in a state where you're getting constant season changes, you gotta learn how to prepare for it, okay? So what is seasonal affective disorder? So throughout this video, I'm going to be using seasonal affective disorder and seasonal depression interchangeably. Seasonal affective disorder is basically when you notice significant changes in your mood and behavior whenever the seasons change, right? So what are the symptoms? You may be feeling lower than usual. You may not want to be going out. You may be experiencing weight gain. You might notice that your mood is off. You may notice that you don't want to be around people. You have trouble thinking clearly. You're experiencing fatigue, low energy level. You have a decreased sex drive. You might have physical problems like headaches, more stress, tics, irritability, anxiety, and just increased sleep. You want to sleep more, or during the day you're drowsy. Those are all common symptoms of seasonal depression, okay? So some people also call it winter depression. Either way, the signs are the season is changing, so now your mood is also changing. So what do we do about that? Okay. Now, people usually ask me, is seasonal depression a real thing? Yes, it is a real thing. Seasonal depression is a real thing. Now, there is no real clear cause of it. However, data has shown that the darker days can disrupt the circadian rhythm, which can cause people to feel depressed. Data has also shown that melatonin, which is a sleep-related hormone, has been linked to seasonal affective disorder, okay? So naturally, the body makes more melatonin when it's dark. So when the days are short and darker, melatonin is made, which can contribute to winter depression, seasonal depression. So let's talk about treatment for seasonal affective disorder. The number one thing is exposure to sunlight, because we know that not having exposure to sunlight is what creates the feelings of depression. Now, that's hard when it's dark out. It gets dark earlier. So one of the recommendations that I often have in session is anytime there's a little bit of light, you want to spend some time outside. You want to spend some time outside or near the window so that you can relieve some of your symptoms. There's also light therapy. I've recommended to my clients to get a vitamin D lamp. You can get that from Amazon. With light therapy, it is having intentional exposure to light for a specific amount of time. So use light therapy in the therapist's office. The therapist basically has a light box and they place it in front of you or off to the side, and you have to keep your eyes open. You can do whatever you want. You can read, you can eat, you can watch TV, but you're just under the light. Okay, and you're under the light for maybe 30 minutes or 30 to 40 minutes. You can do the same thing at home. You can get a light box, and sit in front of it, do whatever you normally do, and, get exposure to light that way. I always also recommend that prior to the winter time, or prior to the weather getting darker, that people get their vitamin D levels checked. Because the natural way that we get vitamin D is from sunlight. And typically people of color, we're typically very low on vitamin D. So ask your doctor for lab work to get vitamin D and see where your levels are. Sometimes, your doctor might say, oh, you don't need it, it's fine. But making sure that your levels are normal is very important. The range of vitamin D is from 30 to 100. So sometimes you might be 31 and your doctor might say, oh, you're normal. But what you have to realize is that you fall on the low range. So it is important to make sure that during the fall or winter time that you're taking vitamin D supplements, okay? Obviously, going to therapy is something that's going to help with seasonal depression because you have a therapist that's working through with you. It's always important. Getting things like exercise is important because that's increasing your endorphins. I often ask clients to write down things that bring them some pleasure. If you like to exercise, if you like to garden, if you like movies, we want to up those things in the wintertime because it's natural that in the wintertime, everybody wants to hibernate. So doing things that make you feel good is also going to be very important. Keep in mind about your environment because people will often make their environment dark to match the weather outside. People dress in darker clothing. Things are just dark and dreary. So I have recommended before, like change your bed sheets. If you're suffering from seasonal depression and your sheets are black or brown or dark blue, change it to a very bright color. Change it to a yellow, change it to an orange. Just change it to something that when you wake up in the morning isn't going to feel so dull. Also recommend things like do things that's going to enhance your senses. So for example, if you like candles, if you like lavender, right, then make sure you have more of that during the winter time. If you like, so for example, I love sunflowers. That's one of my favorite flowers. So if I was suffering from seasonal depression, I would have a bunch of sunflowers around me because they're bright, they appeal to my senses, they appeal to my smell, my sight, right? And it's just a beautiful thing to look at. It's important to be patient with yourself during seasonal depression because you might say to yourself, like, why am I not getting better? It is a gradual progression. You don't just snap out of it. It has to be intentional. And it's very important that if you have seasonal depression, that you're talking to your support system so they know what your coping skills are, right? So if you tell your support system, hey, when the weather gets low, my mood may be off, then they can help you to identify what might be helpful. Like, hey, why don't you go get your candles? Why don't you start gardening again? Why don't you, let's go for a walk. Do things that help give you energy. Of course, there's always medication. I would recommend trying other alternative methods first before making antidepressants your first course of action. But sometimes you can't. Sometimes you need to go immediately into medication. So if you notice that it's hard to function, you can't go to work, everything is extreme effort, then yeah, you may want to consider things like medication. Hopefully these tips can help you. Remember, if you live in a state where the seasons are consistent, right? Come October, November, the weather's going to get darker. It is important to start prepping yourself in like August. Okay, so your mind gets to start prepping for the fact that, hey, the weather's going to be dropping, so my mood might drop. So you want to put things in place. You want to make commitments, right? If you don't belong to a gym, sign up for a gym or a walking club. You want to make commitments because those commitments are hopefully what's going to help you to feel motivated to go out and help improve your symptoms. Hopefully that helped. If there's any other tips that helps your seasonal depression, feel free to put it in the comment. We are here to support each other. So make sure you like and subscribe.